Hello and welcome to C-Section Savvy Session 3. This is all about game changers. As your baby bump continues to grow, the best thing you can do to take control of your journey and empower your recovery is understand our 6 game changers. Knowing what you can do before you give birth can really enhance your recovery. And knowing the best steps to help speed up your recovery is, well, a no-brainer really. Let's get to it. The number 1 vital game changer is the golden rule. Rest. Rest as much as possible. It's normal to feel extremely tired after you've had major surgery. Your body needs time to heal. We already know that the first 2 weeks are essential for creating the right foundation for your scar to heal. And resting is a major part of that. Okay, let's talk housework quickly. I hear women all the time saying, but if I don't do it, then who's gonna do it? I mean, you'd be surprised how much your abdominals are used and engaged when you're vacuuming a house. So to honor the early healing, I would recommend no vacuuming for the first 6 weeks. Remember, housework is gonna be there for the rest of your life. So take this time to rest and help your body heal well. The second vital game changer for C-section recovery is all about the incision. Protect and wrap them. The way we treat our incision makes a huge difference during our C-section recovery. There are 4 things that can help you protect your incision. Number 1, reduce the pressure on your incision by the way that you move and what you do. Take trying to get out of bed. If you were to do a sit-up movement to get yourself up in bed, then you'll be putting greater pressure on your abdominal wall and the incisions, which are still healing. Secondly, keep your wound clean and dry. This will help prevent infection. So that's why they say no baths or pools for the first 6 weeks while your incision is healing. So a shower is your best friend. Just allow the soapy water to run over your incision. There is no need to scrub. Then afterwards, make sure you fully dry the incision by gently patting with a clean towel. And the best tip is use a hairdryer on the cool setting only to help dry your wound. Thirdly, check for infection. Making sure you or your partner check your incision every day is critical. Now warning, if you notice that your wound is becoming more irritated, more red and swollen, if you get a fever, then contact your midwife or your medical team as soon as possible because there's a chance of infection. And number 4, choose your clothing wisely. The goal is not to have anything that could irritate or aggravate your incision while it is healing. Therefore, things like your seams, your zippers, your buttons, where are they? Choose clothes that are loose fitting. And wearing high-waisted clothing during this time is really beneficial. We wrap to help reduce the pressure on your incision. It gives extra support both to your incisions and your abdominal wall while they heal. It can also be a good reminder to remind us, that's right, I've had surgery as we start to feel better. And it helps reduce swelling. So you can use a tubey grip, active shapewear, or a belly wrap. Now please note, these are not waist trainers. It shouldn't be restricting your ability to breathe or to move. It should be supporting you. And then once you've given birth, you can wear it for the first few weeks while you're still swollen post-surgery. We're into the next game changer, mobilize intentionally. It's important to get out of your bed and walk as soon as possible after you've had your surgery, usually within the first 6 to 12 hours. This can be rather scary and unnerving, but it's really important step to take. So why is it important? Research has shown that patients that get up and mobilize and walk as soon as it is safe actually improve their recovery time. It also helps to prevent blood clots, keep constipation at bay, and improving blood circulation to your scar, promoting healing. Once you've had surgery, speak immediately to your nursing staff and let them know that you want to mobilize as soon as possible. Don't do it alone. Make sure that you have their help when you mobilize for the first time and take your time. We've created a video of how to get out of bed safely post C-section. This will help you to reduce pressure on your incision and reduce pain when you're mobilizing. Number 4 game changer is rehabilitation from day 1. That's right, and it's not exercise like you would traditionally think. No, rehab is helping you to safely and mindfully move to reduce pain and prevent further injury. And yes, it's usually boring, but it can make a huge impact in your recovery. So slow down, think like a snail or a glacier. Healing can't be rushed, it will take time, and we start with the foundations. Rehabilitation from day 1 looks like being mindful of your movements. The way you choose to move can either help or hinder your recovery. If you do a sit-up movement in your bed, it will hinder the healing of your abdominal wall. But if you were to use a log roll method, then you will help your recovery and not hinder it. We'll share that with you in another session. Secondly, be intentional with your posture. Whatever we repeat the most becomes our normal. That's how our posture is made. No wonder our posture takes such a huge hit during our pregnancy and early in recovery. The realities of having a newborn is you're sitting a lot, you're nursing, cuddling, and not to mention the limited movement if you have a C-section. And also after surgery, it's really natural to want to hunch over and hunch forward to protect our incision. It's a natural instinct. However, scars naturally heal tight and shortened, but to help our scar to heal well, the importance of being intentional with your posture and standing tall is essential. Number 5 is gradually build up. The goal is safe rehabilitation and recovery so that you can get back to doing the things that you love. Therefore, each movement begins at the foundation. If you want to get back to doing deadlifts, then the beginning foundational movement is a pelvic tilt. If you want to get back to running again, then the foundational movement is walking slowly around your hospital bed. It is not glamorous, it is not fancy, but everything that you desire to do in the future begins with the basic first step. Now, if you forget anything else that I have shared with you today, then please remember this essential final step. Go gently and listen to your body. Everyone handles recovery differently. It can be so easy to compare ourselves, but I want to encourage you, you are unique, and so is your body. Therefore, your journey will be one of a kind. So be kind to yourself. Give your body what it needs, not what you want it to be able to need. In time, you'll be healed and strong and back to doing the things that you love. We just have to give it time. Firstly, if you've got this far, I want to say, well done. You are so wise. This is one of the biggest game changers that I could give you before you give birth. C-Section Savvy is all about preparing pregnant women like yourself to be ready to give birth. Because with knowledge and the tools, you are empowered to make better choices and feel more in control of your birth experience and recovery. Now, before you give birth, these game changers are able to help empower you in your recovery, whether you're having a C-section or not. Use a belly wrap. Now, we've talked about the tubie grip. Use it to help support your abdominal wall as your belly grows. Discuss with your medical team what your birth wishes are. Would you like music playing while you're giving birth? Can they drop the drape just as they are drawing baby up out of your belly so that you can see your beautiful baby first? Now, I'm not saying it's possible to have all of this, but it's worth a discussion. Because if there's one thing that I've seen time and time again is that women who have a calm birthing experience end up healing and recovering at a faster rate. Stronger limbs will make it easier to help push yourself up, to help use your arms to stand up when you're not able to use your abdominals as much. When you're packing your hospital bag, a few things to remember to pop in there. Comfy high-waisted clothing. Remember, you'll still look and probably feel 6 months pregnant initially. Have your tubie get ready. And for some reason, mamas always talk about having lip balm in the hospital because their lips dry out. Initial movements after C-section are definitely more difficult. So how's the layout in your home? Do you have stairs? If you can't avoid them, maybe you can minimize them, or you can climb backwards to help reduce the pressure on your incision. Remember, there's no driving until you're medically cleared, so this could be anywhere from 2 to 6 weeks. So it's a good thing to think about how are you going to get around during that time. The lower the couch or the chair that you're using, the harder the body will have to work to get itself up. And just remember, you might have a little baby in your arms trying to do that, which means you'll even need more help. Meals in the freezer, win, win, win. That way it's easier to be able to get nutritious, healthy meals that will help spur on your recovery. Remember, lack of sleep with a newborn is totally inevitable. So making wise choices now when you're pregnant can go a long way to helping your recovery speed up. Extra help. Massive. You are not weak for asking for help, you are wise. And remembering, how will your household work when your spouse goes back to work? And finally, does your baby that's on the way have an older sibling or siblings? Can they get in and out of their car seat unassisted? These things, again, will help reduce the pressure that you'll have to put on your incision. You see, we focus so much on the baby and being prepared and ready for what the baby will need that we can actually forget to prepare so we can help our bodies heal and recover well. Now, I have 14 top tips for recovery, but today I just wanted to share the top 5 with you. These changed my recovery. Take time to stop and bond with your baby. Some people say that bonding with the baby can be more challenging when you've had a C-section. This is why skin to skin, or otherwise known as kangaroo care, is a game changer. This is when your baby is placed on your chest, skin to skin. This simple step stimulates bonding, helps with milk production, initiates feeding, helps your baby stay calm, breathe more naturally, stay warm, and maintain both their body temperature and blood sugar levels. It's amazing. The beauty of skin to skin is that both you and your partner are able to do this and help improve bonding. This can usually happen as soon as baby is born, and you can continue to do that for months to come and have benefits. And a little side note that some mums have really appreciated me sharing. Bonding with baby is not always love at first sight. Some mothers do, but for many mothers, it's more like a slow burn. My firstborn Ryan was 4 months old before I felt like he had really captured my heart. That didn't make me any less of a loving mother. Sometimes feelings take time to grow, and that is okay. C-section pain during the first couple of weeks after surgery can be pretty intense. So managing pain is essential and not something to be ignored. This is not the time to be a hero and suck it up and push through the pain. If you wait until you're in agony before you take any medication, then it's going to be a lot harder to get control of those pain levels. Therefore, take your pain meds on time. Set alarms on your phone, set reminders, maybe your partner can help you with that, and stay on top of the pain. This will help to calm your body and your body to stimulate healing. And speak with the medical team if something doesn't quite feel right with the pain meds that they've given you, because there are options. Pillow to the rescue! Coughing, sneezing, laughing, any abdominal related movement can make it feel like your stomach is going to explode. It won't, but it does cause a lot of pain. It's because your abdominal wall automatically contracts when you're doing these movements. So when you need to cough, sneeze, or laugh, simply hold a pillow against your incision. This will help reduce the pressure that is pushing out from your incision and help reduce pain. Also, a little tip: on the way home from the hospital, if you have a pillow in your car, you can also place that across your incision in case your roads are bumpy or you've got some speed bumps along the way. A toilet plus a stool for number 2s. What? Because of anesthetic and having surgery and the lack of movement, you'll most likely feel constipated and find it really difficult to move your bowels for the first time. When you're trying to do a number 2, you're putting more pressure on your incision, which can make it feel really scary and painful. So to help combat this, when you sit on the toilet, you also raise your feet on a stool so your knees are just above your hips. This helps to put your body in the best possible position to be able to move your bowels. And of course, the pillow to the rescue once again, you can always use that against your incisions as well. And walking, drinking, eating fiber can also help with this. Help! Yes, this is what we should be asking of our loved ones. And if they offer, is there any way I can help? You reply, yes please. And this will enhance your healing. I know it can be humbling, but it is important. Newborns are demanding, and recovering from major surgery can be exhausting and not best done alone. Asking for help, remember, is not weak, it is wise. Now, as a bonus for completing C-Section Savvy course, we are going to be sending out to you the top 14 tips for early recovery. You'll be glad you knew them before having a C-section, because you can save yourself a whole lot of pain and unneeded frustration and worry. As Birthmark Sisterhood, we work really hard to provide the best support, knowledge, and the tools so that you can really feel empowered before you give birth and all the way through to your recovery. Our program is designed to take the guesswork out of your recovery. We use simple to follow video rehabilitation videos so that there is no guesswork on what is being communicated with each session. So beautiful mummy, you don't have to do this journey alone. Now let's do a quick recap before we have a sneak peek at our next session. In this session, we covered 6 game changers that will make a huge difference in enhancing your C-section recovery. We discussed some of the epic game changers that can make a real difference before you give birth. And we touched on 5 of the top 14 tips for early recovery. And remember, when you complete C-Section Savvy, we will get out those full top 14 tips to you. They're a gold mine. In our next session, I Want My Body Back, we will be covering the myth that is slowing down women's recovery and potentially endangering their body postpartum. We will talk about how to speed up your recovery and 4 signs to know when you've done too much. Now, this is what I needed to know all those years ago. Let's get to it.